Hello, my name is Dr. Larinaga. I'm a board-certified nephrologist performing interventional procedures since 1998. We have our own vascular center taking care of complex patients within our community. Recently, we've been able to participate in a study of a new apparatus that removes permanent dialysis catheters without having to suture or performing any kind of invasive procedures. This is called a TranPac catheter extractor, in which it is apparatus that we're able to perform within our office or in our own vascular center. The apparatus has been recently FDA approved based on the studies that we have performed. Till recently, we have been removing our permanent dialysis catheters who are tunneled in the conventional surgical fashion. I believe the TranPac catheter extractor is a great benefit to the physicians in which they practice in removing these catheters. One, there's no need for surgical cut downs. Two, there's no reason for surgical suturing after removal of the catheter, which can often lead to subsequent infections of the site or even complications with bleeding. By having the TranPac extractor, there's really no cutting, no suturing, simply attaches to the end of the catheter. We're able to do a simple maneuver left and right with the trademark head that's able to cut through the cutaneous tissue. We're able to truly extract the catheter in a very smooth fashion, subsequently holding pressure, putting a Band-Aid or a 4x4 set at the extra site. Within 5 to 10 minutes after the procedure is performed, the patient is able to be discharged home in stable condition.
Prepare the patient as usual. Obtain consent. Identify the area to be worked on. Have the patient lie flat or at a 20 to 30 degree head-up position. Use betadine or an equivalent antiseptic solution to prep the area, as well as the exposed tubing of the catheter. Drape the area using a sterile towel or an equivalent sterile paper. Then draw up anesthetic of choice and inject at the exit site and along the catheter up to where the cuff is located. Using the hemostat included, expand the exit site. Insert the extractor through the slit opening over the exposed catheter. Hold the extractor at the T-handle and with a twisting motion, insert the head of the extractor through the opening. If having difficulty getting under the opening, please use a mosquito hemostat again to expand the opening. Then manipulate the extractor in and out of the opening, noticing the head of the extractor going into the tunnel further and further. With the other hand, hold on to the exposed catheter, pulling at the same time the extractor is inserted. Once through the cuff, the catheter should come out with ease. Constant pressure is to be held at the exit site and at the initial insertion site, either over the jugular area or subclavian vein. Pressure should be held for at least 10 minutes to assure for appropriate thrombosis. Place a sterile dressing over the exit site and no follow-up is needed.
He said that on a scale of 1 to 10, pain was like a 1. He said he trusted me, so he knew it would be okay. ¿Nos puede decir cómo se sintió con el procedimiento que ocurrió hoy?
Sí, el procedimiento es un procedimiento normal. Lo que sucedió fue lo que yo esperaba que sucediera. Yo recomiendo este procedimiento para otras personas que deseen hacerse sacarse el catéter.
Okay. He says that he felt the procedure was everything he expected it to be and that everything went smoothly as planned, and he highly recommends anyone that needs a catheter taken out to be able to use this procedure to take it out in the future.
Sí, fue mucho más fácil venir aquí a la oficina del doctor y hacer el procedimiento aquí en la oficina del doctor.
Okay. He says, yeah, it was a lot easier on him being able to come into the office as opposed to going to a hospital or clinics. My name is Mario Cordova, physician assistant with nephrology consultants for Kissimmee, Florida. I've been using the transcatheter extractor approximately 1 year from its inception in early 2006. The device is working quite well. I have over 40 cases that I've done, fairly easy to use and minimal complications. Patients love the ability to come into the office, be able to get the catheter removed efficiently and be able to return back to the usual duties. Quite easy to use. I've used it on different patients from catheters that were just recently inserted to catheters that have been inserted as of even 2 years prior, and I've really found it to be very simple to be able to remove the catheters that way. I think patients that have had the catheters removed via different procedures in the past, first they get shocked that we're doing it in the office. Secondly, they get shocked that it's so easy to remove in the office and less painful than it would be when they normally have it done in the operating room or other surgical centers. Well, the reimbursement part, I mean, is quite good. I don't think we have any problems with reimbursement. I think the overhead with regards to the procedure is a lot less since you're able to do it here in the office. The amount of supplies that you need are minimal because everything seems to be contained within the kit in itself.
Thank you once again for your attention with respects to the video. I am certain that nurse practitioners, PA, vascular surgeons, or interventional nephrologists within your community will benefit from having the extractor in your facility as much as we've had in ours. We thank you kindly for your attention. If we can provide you with any further information, please feel free to contact us. I am sure you'll be pleased to have this in your office. Thank you.